I wanted to trial it, but the reason why I actually chose to actually purchase it was due to an injury of my own. Now, a few years back, I dislocated my knee and ruptured a lot of ligaments in the knee and had to have it reconstructed. But every now and then I tweak it and it gets painful and inflamed for 24 to 48 hours. And what perked me to definitely buy this laser is had it on trial from you, and I tried it on my knee, and literally within 2 hours it was back functioning normally, and it's never done that before. So that was the light bulb moment for me that I need to have this in my practice.
With the MLS,
people go out feeling a lot better. So the results tend to be quite quick. So people, obviously it's aggravated, it's something that's uncomfortable coming in. You'd give the course for that day or that appointment, and they definitely feel more movement, and reduce, there's a reduction in inflammation and pain importantly. So tend to have very good results. I would say about 80%. Yeah, especially, non-specific sort of, it's difficult to exactly know what the pathology is. I can give a case in a little while, but then a little zap of laser, and every time, I would say, if it's non-specific pain, not really, and you can't see the pathology, so you're looking at possibly further investigations as far as scanning is concerned, not necessarily just ultrasound, but MRI scans. And if patients are losing a little bit of, getting a bit disheartened, then a little course of laser tends to help. Average about 3 to 9 thereabouts. So it's literally, but it depends how the frequency you give it, but it can be weekly or 2 to 3 times a week. It depends how much energy you're going to put into that area. But it's generally about 3 weeks, and they feel an awful lot better. There's the odd 1 or 2 cases which is more prolonged. It's like a little top up, but that's what tends to. It's about 3 to 6 or 3 to 9. Sorry. Yeah, so I probably do things slightly differently to most, because I will tell people, have a little try, see if there's any signs, little hints of improvement. And if there is, then we look to give a course, and so, you give a little taster, and that's the selling factor. They do notice that difference, and it tends to be, they'll sign up straight away. So I had one from last week. Little tester, non-specific ankle pain. I would say, it was probably due to a couple of factors, probably a bit of general osteoarthritis. Unfortunately, a BMI wouldn't be helping either, unfortunately, but she's well aware of that, and give it a course of a standard course of laser. And she emailed me back today, I want to take up this because my mobility is decreasing, and it did improve it after that one hit. A few months back, a 30-year-old lady who non-specific pain, mid-foot sort of pain, diagnosed up at the hospital by the MSK podiatrist as plantar fasciitis. I disagreed with that diagnosis. It was deeper than that. It wasn't the plantar fascia, because she was quite a slim girl, so you could actually feel the plantar fascia, and it wasn't along that. It was deeper. She'd had an MRI scan, diagnostic ultrasound. It wasn't really showing a great deal. Now, compliance from the patient wasn't the greatest, so obviously he told, wear an air cast, rest, didn't do any of that. And first hit of laser, same thing, got back to me, it's better. So it's better, it's 20% better. So she was coming back on a weekly top up. What I suspected was some sort of plantar ligament sort of strain, but her activity wasn't allowing it to rest. She wasn't prepared to rest. So her idea of a rest was a 7-mile walk. And, you know, so, but her activity was increasing all the time. So I'd be like, oh, how have things been? Oh yeah, I'm back powerlifting. Oh, brilliant. Right. How's the pain? It's gone. And, you know, after, I think that was 8 treatments, pain-free. And again, what, you know, like I said, I can only surmise what, I guess what it may have been, but, you know, it wasn't being picked up on any of the diagnostic sort of imagery that was undertaken. But you know, it was diagnosed as plantar fasciitis. I didn't diagnose that. I think it was something different. But again, it's this sort of non-specific foot pain, midfoot pain, and it worked. So, and she's back, yeah, doing her exercise, running, powerlifting, and yeah.
And that's interesting, isn't it? Because I think that's another thing about the laser is, yes, obviously, in whatever you do, whatever modality you offer up to your patients, you've got to get the diagnosis right, haven't you? But actually, with the laser, pain is pain.
Yeah.
Yeah. When you're treating laser, pain is pain, isn't it? Even if you can't be too specific or you're not too sure what it is, you can still treat the symptom, which is pain.
Yeah. Exactly. And that's where it differs to Shockwave, whereby, you know, if, you know, Shockwave is very good, but if you have any hint that it's not, you know, if possibly is any sort of tear of any description, of course, you can't, you know, you just don't, you're not going to touch it with Shockwave, otherwise it could be massive issues over that. So, you know, you treat the symptom to get the pain relief, which obviously the patient will be happy about. Oh, absolutely. And it's not just podiatrists. So in my clinic, there's osteopaths working. So one of the osteopaths uses it. So she uses it. Obviously, they do a lot more manipulation. I don't manipulate in any formal or way. And she's finding it excellent for patients which have got pain guarding. So before they can mobilize or manipulate a joint, they find that some laser will, instead of what they would have done previously, is do a lot of massage, remedial massage to relax the muscles. It can be cut in half. That time can be cut in half with giving laser, so relaxing, so you don't have the guarding. So absolutely, I would recommend it. Sorry, long-winded answer. Yes, a lot. So sometimes not necessary initially, but I do quite, as I've already alluded about the loosening, this sort of loosening and effect, I do give it. So let's say it's plantar fasciitis, the calves are quite tight. I like to give a bit of laser just to help relax there. Now, what I find quite a lot, and a few other people have mentioned this, is people, after about 3 or 4 treatments of Shockwave, patients will start getting pain in the posterior sort of border of the heel. Now, the only way I can get my head around this, because I like to work out why that is the Shockwave's working, which is great, but what's happening is because they've had a air propulsive gait, they've had the calf muscles are tightening up, and because things are loosening up, they start striding more. So, and because of the tight calf muscles, they tend to put this pulling feeling, which can be quite painful on the posterior border. Now, I find that if you laser that area, just using the trigger point setting, so it's 20 seconds, that helps enormously with that discomfort. I use them both daily. It's rare if they don't both get wheeled out. So, you know, they're both alongside one another. So they both get used.
Brilliant.
Daily. Yeah, so if they haven't had it for a sufficient period of time, so my cutoff is 4 to 6 months for Shockwave. If they've had it any less than that, it's laser straight away. but longer that, yeah, I sort of look for a Shockwave, but I know I have used laser as well. It depends on their pain threshold, because yeah, so some people will find Shockwave just too painful. I've had two today, fun enough, where we've started off a Shockwave and I've just switched to laser because, as in full laser, because they're just finding the Shockwave too uncomfortable.
So when you're using Shockwave, out of interest, do you use the ultrasound scanner first?
Oh, absolutely, absolutely. Because I'm quite lucky where I am, is that the NHS don't have Shockwave at all. So the consultants refer patients to me, and I decide whether it's laser or Shockwave. But if there's any suspicion it's anything more than a long-standard, bog-standard plantar fasciitis or Achilles tendonitis or an itis, then I use diagnostic ultrasound every time if there's any suspicion at all. So I had one again today. She's got some specks of calcification. Well, she forgot to tell me that was picked up on X-ray previously. So if there's any suspicion of anything more than that, then definitely use diagnostic ultrasound. That's a tough one. Essential piece of kit.